definitely in the state of Illinois, we could vastly increase the number of prescribers and not put a dent in the mental health need in this state. But I also think that psychologists are particularly in a good position to integrate well with primary care, which we do now, but this would allow us to do so in a much more efficient and thorough way. Mental health facilities across the state have really been under a lot of strain in the last couple of years, and we've felt that very tangibly out here in McHenry County. Last month, one of the largest mental health facilities in this area had to close due to funding problems. That was just this past June. And since then, there have been about 6,000 people that have kind of gone without care. People are having a really tough time finding access to therapy services, much less psychiatric services, which are in a much higher demand, particularly for those folks that either have state insurance or don't have a lot of resources or are having trouble affording to use their own insurance policies because of high deductibles or things like that. So we see a big deficit of care out here. I think that the most tangible benefit to the people that I would see would be immediacy of care. Oftentimes whenever I see somebody, it's their first entrance into the mental health treatment field. And whenever we do an evaluation and decide that medications would be useful alongside therapy, the therapy can begin today, but then the hunt for medication management starts. As it exists right now, we're having to recommend that they schedule an appointment with their physician, which if they already have that relationship can take a week or two. If they don't have that relationship, or if they don't have the resources to make that happen quickly, it's very common that we see people are waiting upwards of a month or more before they can even get in to become evaluated and then start the medication process. If we're able to do that here, whenever we first meet with somebody and discover that it can be useful for them to be on medications, RxP would allow us to do that in a much more direct way that I think would really become efficient and much more comprehensive with the care we provide here.